Hello, my name is Dr. Muhammad Irfan, and I am an instructor in Al Khor University, Mecca. And today we are starting to discuss different clinical scenario used in task-based learning sessions. During the sessions we will be discussing different case presentations and discuss the differential diagnosis, laboratory findings and treatment protocols. So I hope you will enjoy this interactive session series. All of us would have a great chance of learning from these simulations. Frankly speaking, I can't wait to start the session. Good luck for the session ahead. See you.
Assalamu alaikum, my name is Sarah, and he is my dear husband, Ali. We have been married for the last 40 years, and we have 2 kids who are happily married and they are settled in Riyadh. My husband is a known hypertensive, taking medicine for that. He was also a chain smoker and used to take 10 cigarettes a day. But shukr alhamdulillah, he has quitted smoking 2 years back. I can still remember the day when he got heart attack. It was in last December, when we walking in the park.
December last year.
What happened? You weren't looking comfortable while walking this evening.
I am not feeling relaxed today. Something has been bothering me. It's my shoulder probably.
Oh. Let me rub your shoulder.
Allahu Akbar, I am feeling terrible pain in the chest. I am sweating also. It's like a heavy stone upon my chest.
Salamat. Shall I take you to the hospital?
Yes please, do it quick. Am I gonna die?
No, you won't, inshallah, just relax. Somebody help us?
Doctor's cubicle. Today I was very busy, too many patients. I definitely want to relax. Hurry up, doctor. I am Dr. Sami. Please come, we have a patient in ER. What? But, I have just come from ER. And I am really very tired. I need some rest. Don't you think? But this patient is really very serious. I beg you should come immediately. Okay. Tell me, what is the case? Sir, he is a 65 years old male, came with retrosternal chest pain, diaphoresis and dyspnea. So what do you think? I mean, what is your differential diagnosis? This patient is a known hypertensive and an ex-smoker. I suspect that he has acute coronary syndrome evolving. Huh? That's what you think? We should move fast. Every second counts. Yes, move please. Sir, my name is Dr. Sami. I am intern in the coronary care unit. Hi, Dr. Sami. I have seen the case and passed the orders. Please make sure they are carried out properly. Don't worry, sir, I will be along the side of the patient, till he is shifted from CCU to the ward. You were right. This looked like a case of acute coronary syndrome. We need to discuss it in detail. Please come in my office. Sure, sir. Right away. Hospital meeting room. Hospital committee room. May I come in, sir? Oh, Dr. Sami, please come in, have a seat. I was waiting for you. Thank you very much, sir. Well, I like your diagnosis, by the way, but I wanna ask, how did you reach the diagnosis? Sir, actually this patient is an old man of 65 years age. He is a known case of hypertension and diabetes. So I thought he is definitely a case of acute coronary syndrome. That's correct. But can you show me his ECG? Sure, sir. So dear students, now you know the sad story of this patient. Now we will summarize the symptoms quickly, and then we will look at his ECG to conclude some differential diagnosis. So, this patient is an old man who is a no case of hypertension and diabetes. He is an ex-smoker. His family history is also positive for the same ailments. Upon examination, he is febrile, his BP is high. Chest auscultation revealed a slow apex beat, otherwise normal. All other systems are also unremarkable. Now tell me, what are different diseases coming in your mind, keeping the symptoms? Here are a few options.